As many of you know, we've tried to do a lot of different innovations in different either tech platforms or social isolation platforms. This is something that fits directly into what we're trying to do, which is to reach more people, make people feel really engaged with their local communities. And it is something that we're very, very lucky that Greg and New York State Office for the Aging has found great value and some funding availability for AAAs to actually expand this statewide instead of just the pockets that we're currently in. And the team has been a really great partner with us throughout the pandemic to talk about what works, what doesn't work, how to reach hard to reach individuals in non-traditional mechanisms. And we're just really, really excited to be able to launch this.
I think that prior to the pandemic, there were a variety of ways that we reached out to, our customers or others to try to keep them connected to menus in senior centers, things that you guys are doing around the community, emergencies that may pop up, and so many different things. And as Becky said, I think we were approached, about a year and a half ago from Tabitha and her team at Blooming Health. And, what they've been able to do over the last 18 months, I think has been nothing short of extraordinary. And they have a different area that we have yet to really utilize. And we are announcing today is we have joined a partnership with the association NYSOFA and Blooming Health. We want to pilot test this with up to 10,000 older adults. That could be 10 counties, that could be 15 counties, that could be 20 or whatever. And I think given the scope of the things you do every day, this is going to fit a lot more comfortably than some of the other things that have been extraordinarily valuable, but may not be specifically based on your business, like the Get Set Up model, LEQ, and some other things like that.
Looking at the data and what was presented today, you would think this organization has been around for 15 or 20 years, and they haven't. They have literally built this on the fly, and they have done an absolutely amazing job. I want to say thank you to Ontario, Montgomery, and Yonkers. I think peer-to-peer support, especially in the network, is so important. And I think hearing from one another about how this has worked, how the feedback on what didn't work has been looped back to Blooming Health and they've addressed it, speaks to the fact that they're very in tune and they're looking at this product to support older individuals, and they'll continue to build as they go. From the customer's perspective, how nice is it to feel really engaged that your AAA wants you to know about programs and services? On top of that, all the work we're doing across the network as far as value-based payment arrangements and data, this exactly like Yonkers explained, you get a very clean report where you can show the efficacy of your programs. You can also do surveys and actually get a response like Dave mentioned. So I am just so excited that not only, did we have the opportunity to connect, to bring this to the network, but also the fact that once again, New York State Office for the Aging has provided funding for this project. I think that just shows we're going to continue to try and pilot things that work, and we're going to learn as we do so. So this is something we will also be having a fiscal ask for moving forward. So if we're not able to reach you in the first iteration of the funding that we have available, it is something that I will pursue additional outside revenues to generate. And I just want to really, really thank you and your team at Blooming Health for all that you've done and for the friendships we've created over the course of the past year and a half. And I think the data speaks for itself on top of the anecdotal stories of what you've heard. So I just